Thank you for joining us. Today we'll be discussing solutions to 7 medication adherence barriers. My name is Tom Radloff, Senior Director of Account Management here at NAVITUS Health Solutions, and will be your facilitator for our discussion today. Along with me are 3 NAVITUS pharmacists. First, we have Sarah King. Sarah is a clinical account executive and a former NAVITUS Clinical Programs pharmacist based out of our Madison, Wisconsin campus. Sarah earned her Bachelor of Science in Pharmacy from UW-Madison and her doctorate in pharmacy from the University of Florida, and has been with NAVITUS for the past 3 years. Prior to NAVITUS, Sarah has had 15 years experience in retail and clinic settings. She is also a preceptor for the NAVITUS residency program and serves as a clinical instructor for students. Next, we have Tina Patel. Tina is a clinical programs pharmacist and recently joined the Madison team in 2018 after spending 10 years in community pharmacy and 3 years in a hospital setting. Tina earned her doctorate in pharmacy from Drake University and serves as a preceptor for the NAVITUS residency program and is also a clinical instructor for students. And finally, we have Amy Schmerzy. Amy is a senior clinical account executive based out of our Appleton, Wisconsin campus. Amy earned her doctorate in pharmacy from the University of Wisconsin-Madison and has been with NAVITUS for the past 6 years. Prior to NAVITUS, Amy has had 10 years of experience in the community setting. Amy is a preceptor for the NAVITUS residency program and also serves as a clinical instructor for students. With that, I'll turn it over to Sarah to begin our program.
Thanks, Tom, and thanks again, everyone, for joining us. Our goals for today's webinar are to ensure that you understand what medication adherence means and why it's important, that you have confidence in asking for help with your medicines and who to go to for help, and that you have some tips and tricks available that you can use to help be adherent to your prescribed medicines. So first, what does medication adherence mean? It means that you take your medicine regularly, you take it as prescribed by your doctor, you take it for the complete duration, which could be a very short duration, say just a few days, or it could even be for a lifetime, and that you take your medicine without missing any doses. Being adherent to your medicine results in improved quality of life, and you may save on your overall health care costs, as you could avoid extra doctor visits or even an ER visit. Being adherent may also prevent you from needing extra medication or more costly medications. One tool we can use to evaluate our current adherence is called the MORISKY scale. This is a tried and true tool which will ask us some questions to measure our risk for non-adherence. So some questions to consider regarding your medicine routine. Do you ever forget to take your medicine? Are you forgetful at times about taking your medicine? When you feel better, do you sometimes stop taking your medicine? Sometimes, if you feel worse when you take your medicine, do you stop taking it? If you answered yes to 2 or more questions above, then the tips and tricks presented in this webinar will be especially helpful to you. Now that we know a little bit about what adherence is, let's talk about the barriers that keep us from being adherent and how to overcome them. Tina?
Thank you, Sarah. Let's talk about one of the most common reasons patients don't take their medication: forgetting to do so. What can you do to help with remembering to take your medication? Try setting an alarm or a reminder on your phone. Alternatively, you can create text or email alerts to signal when it is time to take your medication, or use a specific medication app to organize these reminders. Ask your pharmacist or prescriber about which applications they recommend. Another useful tool is to use a pill box that can be filled by you weekly or monthly. Organizing your medications this way can also avoid duplicating a dose. Another tip is to keep your medications in a visible place, such as your nightstand or next to the sink. Oftentimes, if it's out of sight, it is out of mind. And lastly, try breaking out of autopilot, and when taking your medications, pause, look at the pill, and tell yourself, I am taking Monday's tablet for my blood pressure. This makes you more likely to have a specific memory trace for the future, and you will be more likely to remember going forward. Another barrier for many patients is finding it difficult to use your medication. This can include difficulty with using an inhaler or putting eye drops in yourself, or something more complicated like giving yourself an injection. If this happens, contact your pharmacist or clinic for help. They may have resources such as instructional videos or guides to help overcome this barrier. Also, remember to save your package insert that comes with your medication prescription so that you can refer to it if any questions arise. Another reason patients may stop taking their medications is because of undesirable side effects. If this happens, consider talking to your pharmacist or clinic. They may have recommendations for alternatives or solutions, such as taking the medication with food or at a different time of day, which can help eliminate side effects. It is very important to keep the lines of communication open with your healthcare team and collaborate with them on medication usage. Amy, I'll turn it over to you. What are some other barriers to adherence?
Thanks, Tina. Another potential barrier to adherence is the belief that a medicine is unnecessary or ineffective. It is very important to take time to learn about your condition, what causes it, what can help it, and what may happen as a result of it. Talk with your doctor to understand why you are taking your medication. He or she will be able to tell you the reasons that the medicine was prescribed and why it is important to take. Your doctor can also help you understand the consequences of not taking your medicine. One reason this barrier is common is because for some conditions, you may not feel sick or feel like you need medicine. An example of this is high cholesterol. Someone with high cholesterol may not have any signs or symptoms that they have a disease. This is dangerous because if cholesterol remains high over a long period of time, it can increase the risk of stroke or heart attack. Taking medication regularly can help prevent that. If you think your medication isn't working, talk to your doctor. He or she may be able to help you measure how the medication is working. For cholesterol, you can have your levels checked to see if your cholesterol has gone down. If the medication isn't working, your doctor may have other options for you to try. Sometimes people may stop taking medication because symptoms have improved. Symptoms improving after taking a medication is actually a good thing. It means the medicine is working and you should keep going for the duration that your doctor prescribed. If you stop taking the medicine, your symptoms may return. Antibiotics are a good example of this. You may start to feel a lot better after taking the medicine for a day or two, but if you stop taking it before you finish the entire course, the infection may actually come back worse than what it was before. Antidepressants are another class of medications that are very important to continue even after your symptoms have improved. You may feel a lot better after taking the medicine for a few weeks, but if you stop taking the medicine, your symptoms may return. Talk to your doctor if you think you want to stop taking a medication before you are supposed to. Another potential barrier to adherence is not being able to afford your medicine. You can ask if there are any pharmacy benefit programs to help lower your pharmacy or overall healthcare costs. For example, the manufacturer of your medicine may offer patient assistance programs for people who have difficulty paying for the medication. In addition, you can ask your doctor or your pharmacist about possible lower-cost alternatives. There may be less expensive medicines that may work just as well for you. Some people have difficulty getting to the pharmacy to pick up their prescriptions. It's possible that your plan may allow you to fill a 90-day supply at a retail pharmacy. This means you only have to go to the pharmacy once every 3 months instead of every month. Some pharmacies will even deliver your medicine. Check with local pharmacies to see if this is an option. You may also be able to receive your medications through the mail from a mail order pharmacy. Check with your employer to see what benefits are available to you.
Thanks, Amy and Tina, for those helpful tips on overcoming non-adherence. I want to finish by talking quickly about the role NAVITUS, your Pharmacy Benefit Manager, or PBM, can play in helping with adherence. As your Pharmacy Benefit Manager, we work closely with your employer, making sure that there are innovative, effective adherence programs which are available to you, and that you have access to safe, effective, and appropriate medicine for treating your disease state. If you're a NAVITUS member, customer care is just a phone call away. Member service representatives are available 24 hours a day, 7 days a week. We strive to make your phone call quick and easy, and we have customer care representatives that are easily accessible without confusing menus to tap through. Our goal is to resolve your phone call in one discussion and get you to the right person to answer your question if necessary. Our phone number can be found on your NAVITUS Benefit ID card. We're eager to answer your pharmacy benefit-related questions.
Thank you for joining us for today's webinar. We hope that with the conclusion of our presentation, you understand how important it is to take your medicine regularly and as directed, that you know who to ask for help, and that you have a toolbox full of tips and tricks to stay adherent and healthy. Have a great day.